opposite from the seasonal flu. The mortality of the seasonal flu that you and I experience every season is about 0.1%. The mortality of this is about 1%, which means it's 10 times more lethal. In seasonal flu, we have never seen hospital rooms, hospital intensive care units overrun, where you run out of beds and you run out of ventilators. We've seen that all over the world. We're seeing it in Europe. We're seeing it in New York City. This is not the seasonal flu. So that one is nailed, definitely.
Got it. And in terms of how it spreads, I've been hearing a lot of conflicting ideas here. Is the virus airborne? And then also, what does that actually mean?
Yeah, well, that's a great question, because airborne means different things to different people. The standard way of a respiratory virus spreading is by droplet, big droplet. And if I cough, the droplet goes a few feet and then just goes down. That's the reason why we say stay 6 feet from each other. When something is airborne, that's misleading. It's what's really called aerosol, which means that when the virus comes out of your respiratory tree, it's in a droplet that's so small that it doesn't just drop to the ground. It can hang around for a period of time, several minutes, usually more than that. It isn't like, 5 hours. I mean, measles can do it for 2 hours, but measles is the worst of that, and this is not like measles. So there probably is a small degree of aerosol, but mostly it's droplet. But the other thing that people don't pay attention to when they're focusing on airborne versus droplet is your
dishwasher looks clean, but grease and lime scale can build up inside. Use Finish dishwasher cleaner.
hands and what you touch. People continually touch their nose and their mouth. They shake hands with people. They grab a doorknob. That's also the way it's transmitted. So that's the reason why we say right now, given what we're going through and maybe forever, nobody should be shaking hands. And I mean that. No one should be shaking hands.
So on that note, how long can the virus live on items? Because I have one friend who goes to the grocery store, gets his essentials, then he will, Lysol wipe down everything, all of his apples and all of his stuff. Is that the right thing to do? Can the virus live on a bag of chips?
Well, viruses can live, this virus particularly, because we've looked specifically, can live on inanimate objects for variable periods of time. It does better on hard surfaces like stainless steel, certain types of plastic. It does less well on cloth and corrugated things, but it can live on a surface for several hours, up to even a day or two. So you don't want to be completely crazy about wiping everything down every minute of the day, but you should use precautions, particularly about wiping down doorknobs and things that are frequently touched, like when you give somebody a credit card, come back, get a wipe and just wipe off the credit card. Common sense things. If you overdo it, you'll paralyze yourself.
Right. Okay, is it true, because I've read this a lot, is it true that the virus struggles to live in hot climates?
Most viruses that are respiratory viruses do much better in cold, dry weather than in warm, moist weather. For that reason, the very classical seasonal viruses like influenza, we're getting to the end of our influenza season now, or even coronaviruses that are the common benign coronaviruses, tend to go away in the summer and come back. That is true. The thing we don't know is whether this particular virus is also going to do that.
So it hasn't been proven yet?
It hasn't been proven because we haven't gotten into the season yet. So what we hope, and this is hope, and I think it's hope based on some reasonable assumptions, that as we mitigate against it, as we do the physical separation that you're doing and that I'm doing right now, combined with the onset of the summer season in the Northern Hemisphere, that we are going to see a diminution of it.
And in terms of precautions, on that note, how well do face masks actually work? Because some people are using them for fashion. They look cool. I'm seeing a lot of Instagram selfies with face masks, but do they actually work to protect you?
Well, face masks are, I'll get to your answer in a second. I'm not going to evade this. The primary purpose of a face mask is to protect a healthcare worker when he or she is taking care of somebody that's sick. The secondary use is to get someone who's sick to put it on themselves to prevent them from infecting somebody else. Other people who want to protect against getting infected in society, they can use face masks. The reason we didn't recommend it early on is we didn't want the supply of face masks to be used for people who didn't really need it when the physicians and the nurses and the healthcare providers who needed it weren't getting it. In a perfect world, if you have enough face masks, there's nothing wrong with wearing a face mask. Is it 100% protective? No way. What is it? Estimate, maybe 50% or so, and that's merely an estimate. There's some degree of protection, but it isn't a completely protective against the transmission.
Right, and I know there's a type of face mask called the N95. I don't know any specifics around it, but I know that's the one that's supposed to be the legitimate one that healthcare workers are supposed to be using. But I did read an article saying that some hospitals in the USA are using the same mask for a week because of shortage of masks. Do those masks expire? Are you supposed to wear for X amount of hours?
The concern is not the expiration over a week. The concern is if you wear a mask and then someone coughs and you have droplets and virus there, that if you keep wearing it the next day, the virus might still be there and you can infect yourself. So it's less that the mask physically expires than it is you're reusing a contaminated mask. That's the problem.
So generally you should, if you're a healthcare worker, you should be switching it out, but there's a shortage of supply.
Exactly, and that's where you got to balance the risk with the benefit.
So the number one panic text I keep receiving, and I'm sure everyone at home can relate, I've gotten so many texts about this, is just about the accuracy of cases. And now this is not to incite fear into anyone, it's honestly just to prepare and give accurate information, but a lot of people say that we don't know the actual number of cases in the US, and it's way worse than we're being told. Can you speak to this a little, about the numbers and the accuracy?
Okay, so the fact is, in the United States, since we are just in the beginning of this ramping up of testing, we don't know the denominator of the number of cases. We're rapidly learning it more and more, because what you do is you do sentinel testing. You get people who come in for flu-like symptoms that may or may not have coronavirus, and you test them. And the latest number, you find out about 10-14% of them have coronavirus, which means that 86% to 90% don't have coronavirus. But the issue is that, I think the point that you're getting to, which is important, is that there are a number of people out there who are without symptoms. They feel well, but they're infected. Those are the ones that you're concerned that they're going to inadvertently pass the infection on to someone else. What percentage of the totality of the coronavirus infection is asymptomatic? We don't know. We don't think it's a vast, large percentage. We think it's relatively small. But I say that with some trepidation because we haven't looked at it in an orderly way.
Well, I appreciate that very transparent answer. On that note, a more positive, is there any vaccines or cures that you know of? And I asked this because I saw on Instagram, I was scrolling through Instagram, and I saw that, this is what it said, Canada has found the cure. Now, I also have a lot of Canadian friends. I am a proud Canadian, so I don't know if we're just biased and trying to be proud, but is there a vaccine or cure for this virus?
God bless Canada, but they haven't found the cure, okay? So
we had one thing going for us, no, I'm kidding.
Now, the situation is that we have vaccine, one and more coming online, that we started a vaccine trial a few weeks ago. I've been talking about this a lot. It's the fastest we've ever gone into human trials. Even that rocket speed, it's not going to be available for at least a year and a half. So there's no proven and effective vaccine, but we will have one if we get another cycle and we go through the next seasons. Number two, there are a lot of drugs out there that are being tested. The only way you can tell that a drug really works is to do the kind of trial where you compare it to something. It's called a randomized controlled trial. We have a number of interventions that are currently being looked at in that auspices of a trial. There are a lot of claims that there are drugs out there that are approved for other things that are knockout drugs that work. That's anecdotal information based not on scientific evidence, but based on a lot of stories that this may work or not work. And that's where your friends are coming in and saying, oh, we heard there's a drug that really works. There is no definitively proven drug that is effective against this disease.
Or on that note, I also had, this might have been one of my Indian undies that said this to me because it sounds like it, but vitamin C can ward off the virus, I've been told.
Well, you know, vitamin C is a good antioxidant. There's no proof it could ward off the virus, but there's no harm in taking vitamin C as long as you don't take ridiculously large doses. The same thing is true for vitamin D. You know, many people around in our society are vitamin D deficient. You get it naturally from sunlight. Often we don't get enough sunlight. There's nothing wrong with also supplementing with vitamin D. Are they specifically going to help you with the virus? Maybe not, but it's one of those things that it's a healthy thing to do.
So same with turmeric and ginger. So I should tell my mom turmeric and ginger are not curing this virus.
Oh, you could tell her that your herbs are not curing the virus.
Okay, you hear that? The turmeric is not going to help this one. Okay. I started a social good initiative called Girl Love. Clearly, I'm wearing the sweater. It is aimed to empower women. So on behalf of that community, I want to ask, because I've seen some things on the internet about this too. Does the virus affect men and women differently?
Maybe not differently, but certainly more men are getting infected and getting in trouble than women.
And why is that?
We don't know that. We absolutely don't know. I have to be, humble about this. I don't know yet. We're going to be studying it. It may be that men have more underlying conditions that lead them to get a more serious disease. Mm-hmm. It isn't that men get more infections than women. They get more seriously ill than women.
I also was part of an email chain I got that was being passed this information. It said that Advil makes the virus 10 times worse. Can you speak to that?
There is no evidence to indicate that any anti-inflammatory makes the virus worse. There are anecdotal stories about that, but I have not seen any convincing evidence that that's the case.
Okay, this is a tough question, but I'm sure you're gonna ask it a lot. I know we only have a couple minutes left here. Everyone keeps wondering when this is going to end. I've heard people say, oh, this is only gonna last a couple of weeks more, months. Is there any way to tell when will our lives resume to normal state?
No, you can't predict it, but you can look at what's happened with this same epidemic in other countries. I mean, in China, it was about an 8 to 9 week before it went up and down. In Korea, it turned the corner in several weeks. We are right now, as a country, have multiple epidemics going on because we're a big country. New York is different from Florida, is different from Washington. As a country, it's probably going to be several weeks before we see a turnaround. Several weeks.
Last question for you. On a lighter note, you've taught me a lot of things here. Since we're making a YouTube video and the goal is to get clicks, get people the right information, my last question for you is, have you ever posed for a YouTube thumbnail?
No.
Okay, would you like to do that with me to get people? So you could do I don't know if there's an infamous pose you have that the internet knows of, or if you want to do a thumbs up or whatever it is. Here's my expertise onto you since you've taught me.